Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham. We are streaming live at our midweek podcast, as we always do every Thursday, 8 to 9 a.m. Pacific Standard Time. And I am super excited to have Dr. Ryan here on our show today. He is going to be talking about interstitial cystitis and urinary tract health. This is something that we talk about all the time at our pharmacy because we do a lot of estriol vaginal cream for urinary tract health for women. So it's something I'm super excited to hear about and learn more about so I can share it with my patients. So without further ado, Dr. Heer, welcome to our show.
Hi, nice to be here.
Yeah. So tell us a little bit about, let's start with interstitial cystitis and just let's define what that is.
Sure.
And then maybe some treatments.
Sure. So interstitial cystitis, or oftentimes called bladder or painful bladder syndrome, is characterized by bladder pain of variable severity, really, over a long period of time. It's more common in women. Usually happens in typically the fourth decade of life, but can happen a little bit earlier. Unknown etiology, so not exactly sure where it's coming from. Sometimes it can be due to a host of different reasons, which we'll get into in a little bit. But it is characterized by a lot of pain and discomfort, and patients usually will report to me having a lot of bladder sensitivity, pain with urination, even fatigue and depression due to how long this has been going on. Pain with sex is very common too, and can cost a lot of money. I think last time I read that there was like $65.9 million a year in healthcare cost, and so oftentimes these patients also see multiple different providers for IC. They go and go to different urologists, go to different pain specialists to try to identify what's been going on. A lot of tests come back negative for them, and so when they're doing urine cultures to see if it's a UTI, it comes back negative. When they do cystoscopies to look inside the bladder wall, it comes back negative. So very complex disease process, and unfortunately results in a lot of pain for people.
And so tell me about some of the treatments. Do you dive into what's causing it possibly instead of just treating symptoms, or how is the best, what's the best route to go?
Yeah, great question. So my job really is to be kind of the detective in all this and really try to identify what's going on. IC is oftentimes too a blanket diagnosis. You sometimes get that with IBS. It's like, oh, well, there's irritable bowel syndrome. We're not exactly sure what's going on. Has some diarrhea, some a little bit of constipation, a little bit of both. IC is similar in that aspect, is that it is oftentimes given presumptively or prematurely sometimes, and just because they don't know exactly what's going on. And so usually for the first little bit, we will dive in and talk about different aspects of health. So autoimmunity has a big part to play when it comes to bladder health. Dealing with chronic infections such as Lyme or EBV have an aspect and that can also cause a lot of bladder issues as well. And then going into, if it is bacterial in nature. And what we're starting to find out more and more is when we do a little bit more advanced testing with these urine cultures, because your standard urine culture is okay. It's not the most sensitive and specific test, but when we look at more advanced urine cultures, we're able to identify certain microbes and pathogens that have been more embedded into the bladder wall, and that can be the cause of a lot of these symptoms. And we're starting to see that more and more. And so when it comes to treatment for embedded urinary tract infections, oftentimes, an oral antibiotic, a lot of times patients have been on a lot of different oral antibiotics. They've tried everything and nothing seems to work. They might be on it for 5 or 6 days and then, go off of it for a bit, might see some benefit, and then usually have a lot of GI issues if they've been doing it for too long. So when we identify which pathogen it is, usually due to the nature of embedded infections, what they do is they form what's called a biofilm over top of it. So your pathogens such as Klebsiella, Pseudomonas, are big biofilm disruptors, or biofilm producers, and so they trap themselves inside that bladder wall and cause a lot of pain and irritation. Whereas E. coli and Enterococcus, they still do form. Those are definitely the more common microbes that you see in urinary tract infections. They still do form biofilms, but not as much. And so when it comes to treatment side of things for the bacterial side of things, it usually is either a different herbal concoction. So whether it's uva ursi, corn silk, cranberry, we're using a lot of different herbs depending on which microbe shows up, whether it's gram positive, gram negative, determining the urine pH, gets into a lot of different things. But also we're using things such as bladder installations, which are a compounded antibiotic formulation that you can insert through a catheter into the bladder wall and provide some relief, some direct kind of approach instead of going through the GI system and causing some dysbiosis into the GI tract. We're able to hit it hard where it's at. Now, oftentimes too, I'll include a EDTA, which is a biofilm disruptor, into my bladder irrigations to be able to kind of break up those biofilms. So that's one aspect of it. Also use sometimes a vaginal estrogen cream if we're dealing a lot with dyspareunia or painless sex or vaginal dryness. That can be a big cause to some of these IC-like symptoms, and it can provide a lot of relief. So compounded estriol cream, which I think you guys do very well, is a great treatment option for that, and can oftentimes be overlooked, especially with a lot of different providers, and can be an easy fix. So that's kind of a bulk or an overview of treatment, but there's definitely other aspects of it that you can get into.
Yeah, well, thank you for that. And one thing when I talk to urologists, sometimes I have to remind them, when they treat chronic urinary tract infections, I have to remind them about estriol vaginal cream. And one thing I'll say, it's like, well, why does this woman that's 60-some years old all of a sudden have chronic urinary tract infections? I mean, what does she lack? Why did she not have them when she was 35? Well, because she had estrogen. So, and estriol won't necessarily treat the infection, but it'll definitely help prevent them. And it's a game changer for a lot of people. I honestly, estriol vaginal cream is our number one prescription of everything we compound up, and we ship it all over the country. And traditional urologists, traditional gynecologists prescribe it. And I honestly think that every woman should be on some kind of topical vaginal estrogen, because if they don't have bladder symptoms yet, whether it be urinary tract infections or whether it be urinary incontinence, they will eventually if they don't use that or some kind of estrogen vaginal cream. So, tell me about these bladder installations, the treatment. Is that a one-time treatment? Do they have to come in multiple times? How does that work?
So I wish it was a one-time treatment. That makes things a lot easier. But oftentimes it's not. And sometimes, so usually with the bladder irrigations, they're dosed depending on which formulation you have. So sometimes, some pharmaceuticals work well together, sometimes they don't, and need to be compounded separately. And then depending too on whether you have gram positive only or gram negative only, and then susceptibility for each antibiotic to which microbe it is. So with that, you usually will dose twice a day. You have like 30 milliliter syringes, and you can do those twice a day. And you do it for 2 weeks. And then after those 2 weeks, I reassess and see kind of where we're at. We're starting to see some real benefit. I might extend those out to a maximum of 4 weeks. I usually don't go over that. And then we retest and kind of see where we're at as far as the microbe load. If we're still experiencing symptoms, if we still have some microbes, then we will do the bladder irrigation again. Sometimes I have people on bladder irrigations that do them 10, 20 times. It's just really bad embedded infections. And I see people that have had these for 10, 15, 20 years. And so they can be, and we do see progress over that period of time. So we know that we're getting rid of those bacteria, but it just can be very problematic. And so, but usually the first go-to dosage is twice a day for 2 weeks. It's kind of how I dose those.
So it sounds like you've done this quite a few times. You haven't really been practicing that long, like 5 years, I believe. So, and interstitial cystitis is, I'm not going to say it's rare, and you're definitely going to say it's not rare because you see a lot of them.
Right.
How did you get into this?
Yeah, so I've got some family members that have dealt with some chronic bladder infections, and having that kind of as a motivating factor for when I had one patient reach out to me and said, hey, I've been dealing with this thing for a long period of time. I have been doing some research on my own, encountered some different providers. I just wanted to know if you could look into it a little bit more. And so having that family history really kind of sparked my interest in it, and doing more deep dive into it, really saw that there was a big area of need with a patient population that really has been overlooked for the most part. And unfortunately, they've seen multiple different providers and either get overlooked or get diagnosed with just chronic pain syndrome or fibromyalgia and said, hey, you just have to kind of deal with this. And so, that's really how I got involved in it, was really just one patient and then family history of having chronic bladder infections and running the family. So
is there anything after treatment and you kind of get the bacteria eliminated? Is there anything as far as lifestyle or diet that somebody can do routinely to prevent the problem?
Absolutely. So when we try to replenish that microbiome that's been usually not only hit with the long-term antibiotic use, but to prevent any microbes from regrowing into that area, obviously hygiene is number one. Making sure that they practice proper hygiene, making sure that they have a good diversity of diet. So not only adding probiotics but prebiotic foods can be very important. And a lot of studies have been showing that the more diversity that you have in your diet, the better. There definitely are some trigger foods. So some of those more citrus related foods can be triggers for some people. Alcohol can be a big trigger for that inflammatory nature side of things. And so identifying food triggers can be helpful, but oftentimes too with food triggers comes GI issues. So making sure that you have your GI system managed well, making sure that your inflammatory level is low, and then making sure that your hormone levels are in check. And so oftentimes I will run more advanced, hormone testing. And so Dutch, and I'm not paid by anyone, so I don't have any disclosures, but Dutch is a good hormone test that looks at, your estrogen levels, your progesterone, testosterone, DHEA, cortisol. And so that will help me to identify if there is a certain hormonal deficiency, and especially if you're a person that will take testosterone and move it into, say, estrone, the more harmful form of estrogen, instead of the estriol or the estradiol, then that can help me to correct that. And so, it's a very comprehensive approach, because oftentimes with these patients, if they just go back to normal, then, I see them later on and say like, oh, I've been dealing with this again. So, yeah.
Well, and our whole goal, in my opinion, unfortunately, the traditional healthcare system is not this way. They just treat disease and treat disease and treat disease. But my goal is to actually, not just treat, because sometimes you have to, but help prevent that disease. So we're not just constantly, taking care of sick patients. We want to keep them well, right?
Right. And the preventative side of things is, that's the key, is to try to prevent it from happening in the first place. And with chronic disease and with preventive disease, you're right. It's just not something that is oftentimes focused in on the traditional conventional medical care. But hey, that's what we're trying to change.
That's right. That's why we're talking about this, right?
Yeah.
So prebiotic and probiotic foods. So you being a naturopath, you're an expert in this area. I'm going to put you on the spot. Give us some examples of prebiotic and probiotic foods.
Yeah. So prebiotics there's a lot of different prebiotic rich foods. A lot of vegetables and fruits and stuff fall within that. even different spices and everything can fall within those prebiotic foods. And when we think of prebiotic, we're trying to provide the biome with the tools that it needs to build a healthy biome. And so when you're talking about vegetables, different like asparagus, broccoli, cauliflower, red peppers, green peppers, those things can be prebiotics. When you get into the probiotics, it's more providing these are actual probiotics that have been fermented in food. So with those, they're usually like your sauerkrauts, your kimchis, kombucha, low sugar. I prefer low sugar kombucha. Yeah. And kefir, which is drinkable yogurt. Pickles even have some probiotic properties. But those are more the probiotic side of things. Having too many probiotics can definitely cause some gas and irritation. So I try to make people do more of the prebiotic, give them the fuel. And there's even and I won't get into this too much, but a postbiotic, and it's a whole different world that's kind of being researched on right now. But those prebiotic and probiotic foods are definitely crucial when it comes to maintaining and cultivating a good microbiome.
Well, we might have to do another show on postbiotics because I'd like the education on that.
Yeah.
So you said it. So you said low sugar. You kind of believe in low sugar kombucha. And I get asked about kombucha. And I'm a believer in kombucha. One thing I always, not always, but, one thing I do warn people about is that, kombucha does, if it's just regular kombucha, it does have sugar in it. And so you got to worry about not just issues with sugar that can cause, but also it has extra calories. So, drinking, a lot of kombucha could add up your calories. And if it is sugar, it can cause some problems. So speaking of sugar and urinary tract health, how does that go hand in hand?
Sugar can cause a lot of inflammation, and sugar is fuel for bacteria. And so when we are thinking of embedded infections, that bacteria will take that sugar and kind of help to grow. And so not only is it causing irritation to that bladder wall, to the bladder epithelium really in general, but excess sugar in the blood and in the urine can cause different aspects of the immune system to become more inflammatory. And so that those blood vessels that supply the bladder epithelium will also become irritated. And then so you get a little bit of both. You get, unfortunately, some bacterial growth, and then you get some inflammation that makes the symptoms appear worse than they are. So sugar is definitely not a friend when it comes to bladder IC and to chronic bladder infections.
Well, and we think about the ultimate case of that, it's with diabetes, right? Diabetics have a big problem with sugar in their urine. I mean, diabetes mellitus, which is, the common form of diabetes that we hear about. Literally diabetes means siphon, mellitus means honey. So it literally means you are siphoning out honey. You are peeing out honey is literally what it means from, I think, Greek. And as we know, diabetics have an issue with a lot of urinary tract type issues because of that.
Yeah. And with diabetics, you start to have those microbes that you don't usually see, like fungus and Kleb, is one that really can show up. The abnormal infections come up with diabetics, which makes it even harder to treat. So that's why it's even more important to really focus in on increasing your fiber content, because fiber helps to pull that sugar in and use it properly, and lower just your sugar load in general.
Right.
But avoiding sugar-rich foods is definitely important.
So one thing I was thinking about, as a pharmacist, Jan and I, we're talking about diabetes mellitus and sugar in the urine. And there's actually a drug that was developed, Jardiance. I'm just going to say the brand name because that's what most people know it as. And I remember when it was developed and we heard the mechanism that it basically helped you pee out sugar. So it made your urine really concentrated in sugar. And we're like, I mean, Think about the disease by diabetes mellitus. That's a problem.
Yeah.
Yet, we have a blood glucose number that we want to lower. So we give a drug to help them pee out the sugar. And lo and behold, it causes all kind of urinary tract infections. And it's not fixing the problem. I mean, the problem is carbohydrates. You're eating too much sugar, right?
Yeah, it's a temporary fix. And, that will make the lab values appear a little bit normal. And so, your A1C will go down for a little bit. But that underlying mechanism as to why it happened in the first place is not being addressed. And so you will become insulin dependent. You'll have further complications, deal with chronic infection, which causes a lot of inflammation. Then you get into what is inflammation doing to your heart, your brain, your lungs, your kidneys? And so it is a temporary fix for a long-term solution, which again, it's hey, if it, a lot of these studies look at patient outcomes within 3 to 6 months, maybe a year. And so if you're looking at more longevity studies, you can see actually, I don't know if it provides that much more benefit. So it's definitely something that short-sighted, but hey, let's get those numbers looking great, and then that makes us feel good. Later.
That's kind of the way our healthcare system works in general. Is we put a Band-Aid on a bullet hole, and it's not really fixing the problem. And I mean, that's one of the reasons I like working with doctors like yourself, because you get to the underlying cause and want to fix the problem instead of just treating symptoms. And, sugar in the urine is just a symptom of diabetes. It's not really treating out, like you say, the underlying cause, and then all the complications that come along with it. And like you say, outcomes are, the damage is done over years, and most people aren't diagnosed with diabetes until 10, 15 years post-fact. So there's been a lot of damage done in the meantime. So that's why it's important to, go to a doctor that looks at, underlying causes and knows how to dive deep into it instead of just treating a number, right?
Yeah, and that's what we're starting to try to really push on a more global scale, is that preventative side of things. Because yes, a hemoglobin A1C will be able to detect blood sugar over a 3-month period of time, right? And so, the ranges for that, for the pre-diabetes, based off of what normal labs say, was 5.7 to 6.4 is that pre-diabetes, and then 6.5 and above is diabetes. And so, but what we're starting to find out is that hemoglobin A1C is sometimes we're catching a little bit too late. And so when we're even getting to that 5.5, 5.6, 5.7, we're fighting uphill, so to speak. And so making sure that your insulin levels, seeing what the insulin is, making sure that you're looking at your overall cholesterol, so your triglycerides specifically that are more focused on sugar, making sure that you're looking at your blood pressure, kidney function. Those things are important, so we can help to identify things that might be warning signs. And obviously talking to each individual patient about your diet, your exercise, your lifestyle, all those things that are so crucial and oftentimes the hardest things to fix, but can be also the most rewarding things long term.
Right.
So yeah, it's identifying the precursors to it and not catching it when it's we're too late. So
well, I'm glad you brought that up, and I was going to actually ask you about insulin, because I think that's a better one to check, honestly, because there's a lot of people walking around with pre-diabetes or normal glucoses, and you can just look at them, Dr. Heer, and it's they're not metabolically healthy. I mean, this can't be. And if you look at their insulin level, their pancreas is still responding for now. Yeah. So, their pancreas is still working. So it's putting out a lot of insulin, and you look at their insulin level and it's probably sky high. Yeah. And insulin is I think insulin resistance is one of the most damaging thing, as far as inflammation and cardiovascular effects long term. I think insulin is a problem, high insulin, and I think it should be more routine to check an insulin level than glucose level. Now, speaking of our traditional healthcare system, most people will say, well, insurance companies don't cover an insulin level. which is just incredible to me. And we haven't really found until that happens, it's probably not going to be routine. But here's what I tell my patients: don't let an insurance company dictate your health. Pay cash for an insulin level. Who cares what your insurance company says? It's worth knowing.
Yeah. And that's honestly one of the reasons why I transitioned my practice to being a non-insurance model, is because I was getting poor reimbursements for even, my work. And so, and then when I would be running running labs for patients that were looking at insulin levels, and they would be running it through their insurance and getting these huge astronomical bills for labs that shouldn't cost that much at all, I was like, well, there has to be a better way to do this. And so the way that my practice operates is kind of outside of that. And so, this is, we won't get into too much of it, but
please share this. I love it.
So, members of my practice, which is Crossroads Integrated Medicine, get access to the pricing that I get. And so the labs will give pricing based off of you as a client, or they'll give a patient pricing, and then they'll have an insurance pricing. And so the client pricing, which is my pricing, is oftentimes the lowest. Well, I want patients to be able to access that. I want patients to be able to, because that ultimately is going to be better for their care. If we can remove the obstacles. I mean, they're paying usually with their deductibles, hundreds and hundreds of dollars at every paycheck, essentially, right, to get care that is okay. Well, that shouldn't be the case. And so when you become, a member of my practice, you get what I get. And so there's going to be, an insulin for me, and I'll have to look up exactly, but it might cost me $20 to run. Whereas
I was going to guess $20, right?
Yeah. And whereas you run it through insurance, it's going to be $200. It's going to be something that's way more than that. And like vitamin D, for example, I had unfortunately a patient that reached out to me after they ran it and said, hey, this vitamin D cost me $250. And I'm like, you gotta be kidding me. It cost me $16 to run a vitamin D. There's no way that it should cost you that much. And so, when we're thinking a preventative side of medicine, these labs oftentimes can be life-saving. And so why should patients have to jump through all these different hoops, haggle with their insurance providers, haggle with their doctors to order these tests that are dictated by the insurance companies? Why don't they have access to them? And so there are some places where you can order like any lab test now, Ulta Labs, you can order, labs as an individual, but without any proper guidance, you're kind of not knowing exactly what to do with it. And then when you get the results, an insulin, for example, the range for that, I think, is a lot higher than what it should be. And so like when I see insulin above 5, above 10, I'm like, oh, well, that's actually, we need to look at that. That's something that's shouldn't be ignored. Yes, it falls within the normal range, but gives us a little bit of clues as to what's going on. And so ultimately, that's what my practice is trying to do. And that's what a lot of different practices are kind of transitioning towards, is moving to make it patient-centered care, essentially, just trying to be as cheesy as it sounds, but really just give the patients what they actually need without having to pay a huge price for something that is giving them subpar care. So,
well, we realized it, my wife and I at Moses Lake Professional Pharmacy, we realized it 20 plus years ago that insurance was a ripoff.
Yeah.
So we stopped billing insurance over 20 years ago, and we were called crazy. And in reality, and there were people, including employees and family and friends, that, well, you guys aren't going to be able to stay in business. And my colleagues, in reality, we were kind of pioneers because, fast forward 20 years and there's a lot of people following in our footsteps saying, cash is the way to go, because why? Patients get a better price, a better service, and better quality, period. I will argue that till I'm blue in the face. I don't care what any corporate healthcare, any hospital wants to say that their quality is better, because it's, that's why it's more expensive. No, that's a lie. And having a third party in between us and the patient, as you know, just makes things more expensive, more complicated. So, and really, routine healthcare, like you and I provide, for routine, non-emergent TC type big stuff, is very, very inexpensive if you shop around for it.
Right. It is. It's very inexpensive. And, And I think people are starting to realize this more and more, is that better quality preventative, just your standard healthcare routine checkups, the better that is, the less likely you're going to have to do those emergent healthcare costs. And so, saving money in the long run, if you're thinking about it, like, it is a billion times more worth doing the cash, just paying for better quality healthcare in the meantime, and instead of having subpar care that's dictated by insurance companies, that's the doctors have to go through all these different prior authorizations just to get you to get insurance coverage for one medication that costs like $15 if you bought it cash.
Right.
It's ridiculous.
It's crazy. Right. Yeah. Well, I'm glad that you're not playing the game anymore. That's part of the solution, is for us to educate and empower individuals to take charge of their own health. And then, healthcare professionals not playing the game. I had a direct primary care doctor tell us one time on the podcast that the only way to change the system, he thought, was to get out of the system. And in some ways, I agree with that. There's always going to be that other system. That's fine. I just don't want to be in it as a healthcare professional or a patient. I will seek other alternatives. So I actually wrote a book about it, and being a guest on our show, you will get a copy of the book.
Great.
It's called Sickened: How the Government Ruined Healthcare and How to Fix It. And in chapter 6, there's a 6-step solution. And at the very top, I have a little quote from me that said, the best health insurance we have, and you kind of alluded to this, the best health insurance we have is not some kind of policy that we can buy. It's how we take care of ourselves in the first place.
100%.
Yeah. That's the best health insurance we can have, and we just have to, we have to educate people about that, health insurance is not taking care of your health. That's for sure. They do not care about that at all.
Right. Yeah. I mean, and it's just, it's sad. And the one aspect of health insurance that has been very hard for some patients is, some patients can't afford to get good quality healthcare. And I think that's a point that has to always be recognized.
Yeah.
And that they are reliant on the health insurance model. And so working out, from the outside through direct primary care, there definitely needs to be that aspect. But I would hope that eventually some people on the inside can start to see those faults and deficiencies, and that's essentially what naturopathic medicine is trying to do in a lot of different states. Is when I was practicing in Oregon primarily as a resident, we were in that insurance care model, and we were able to see patients that were on Medicaid and were able to provide a little bit more comprehensive care than they were used to, and so it was beneficial. It's hard. It's very hard because you have to deal with a lot with. As a resident, I was on the phone every day with insurance companies trying to get prior authorization for patients, trying to get certain medications or imaging approved that were routines. Like, come on, like, this has to be, like, why am I wasting my time doing it? But, there is an area for that, for patients. And so basically what I'm trying to say is, it needs to be in the current model that, despite just tearing it all down and just doing straight cash base, but in the current model, there needs to be this kind of care accessible for everyone. And so, whether that's getting people that are more of that holistic functional medicine kind of minded, and more legislative support on state-by-state basis. I mean, here in Indiana, naturopathic doctors aren't recognized quite yet. We're in that pre-licensure stage. But we actually just were awarded a grant from the AANP, which is the Naturopathic Association, on the global scale for helping to promote legislation in Indiana. So we're making improvements, but it's definitely, we've got some room to grow. And even if insurance was open for the state of Indiana, I just see patients that just do not improve in that model. So I don't know if I'll ever really even move to that point. But
it's kind of a sick care model. I mean, it really is. And, with the way insurance companies and big pharma are kind of in a cartel together, and the government kind of allows it or does allow it, I'm kind of pessimistic, and I'm not holding my breath for the government to come in and fix it. So, I appreciate doctors like yourself that are still giving good quality care for at a valuable price. So, I think that's what's important. So, as we wrap this podcast up, tell us what your passion is.
Oh man, how many passions do I have? Many. I mean, outside of medicine, I'm obviously passionate about, with medicine, it's just, this chronic bladder, IC, embedded infections, that really is a huge passion of mine, because I think that it pulls in so many different aspects of healthcare, really allows me as a naturopathic physician to be very comprehensive, looking at the GI, looking at autoimmune, looking at even cardiovascular, which cardiovascular is another passion of mine. So that has been able to really open up a lot of doors and allow me to hear a lot of patient stories and provide a lot of good care to patients. So there's that passion. Outside of that, have a new 4-month-old baby, and she definitely has occupied all of our lives, and we love her and love it. But just recently did my first full Ironman in Chattanooga, and that was
congratulations on the baby and the Ironman.
Thank you. I would say that my wife would probably say the baby's definitely the more challenging aspect of that. But being in Indiana, being able to go bike in the fall, I'm staring outside my window right now and see the fall weather. That's I can't wait to go out and keep training and keep doing stuff on the bike and swim and run and everything. So that's a big passion of mine. And then can't wait for basketball season. I love basketball.
Yeah, it's preseason starting just now or something, I think.
Yeah, Pacers first game yesterday. So
yeah, college starts a little bit later, but we were just watching a special on the on Hulu on the history of the LA Lakers, not the whole history, but basically since Jerry Buss took over. Interesting. If you get a chance, if you're a real basketball fan, especially a Lakers fan, it's interesting to watch for sure.
Can't stand the Lakers, but that's fine. The 2000, they took our NBA championship away from Reggie Miller and the Pacers. So.
That's true, right? Yeah, right. Yeah. That's true. Yeah. All right. Well, Dr. Heer, thank you for being on today. Tell us how to get a hold of you.
So you can reach me by my website, crossroadsintegrative.com. That is honestly the easiest way. If you want to shoot me an email, it's drryan@crossroadsintegrative.com, or you can give us a call at 317-426-7557. But that's usually the best way. I'm not super great with social media, so if you try to contact me through Facebook and Instagram, it might take a while, but reach out. And look us up and see what we have to offer.
Sounds good. Well, thank you for being on today. You definitely helped us realize our goal of educating and empowering patients to take charge of their own health. So thank you so much, listeners and viewers. Thank you, Dr. Heer. Thank you, listeners and viewers, for tuning in today. Tune in Monday, our regularly scheduled podcast, Monday, 12:30 to 1:30, right here on my personal Facebook page, LinkedIn, and my Twitter, and a Mosley Professional Pharmacy YouTube site. 12:30 to 1, we will have Leah Strike on our show, and she's going to talk about her story about how and why she got into functional medicine. You might want to tune into that one, Dr. Heer.
Yeah, sounds good.
Yeah. So thanks, everyone, for tuning in today. Really appreciate you guys. We will see you Monday.